All right, hi. Welcome to the channel, DS Nutra Consultant. I'm glad you're here. I'm glad you're taking the time to tune in and listen to this YouTube channel and look at it also. So now, again, I keep forgetting to ask, so I'm going to ask right now at the top. Please feel free to subscribe, like, make a comment. I do appreciate when you do make a comment. At least it gives me an idea that some people are actually looking or watching these videos. And again, subscribe, So again, we're DS Nutra Consulting, and we are about providing consulting services to customers in the pharmaceutical and dietary supplement and cannabis industry space, in all areas of quality control, quality assurance, and regulations. Now, so today I'm going to speak briefly on this concept called quality by input, or QBI. Sometimes it's also referred to quantification by input, or quantified by input. And what is this? This is a technique used, and I like to call it a test non-test. And it is used when there is not an appropriate test method or a way to quantify an ingredient or a compound in a finished formulation. So for instance, if you're making a formulation of green tea in a pill form, and so you have your botanical, or you have green tea root or green tea leaves, or whatever it is you're using to make your finished formulation, on that label, you have to then certify, or you have to label your package to show how much green tea is in your formulation, and that it could be how much green tea per capsule or per serving, whatever your serving size is. And so now if you take your product to the laboratory and ask for a test, and let's say that on your label you have 100 milligrams of green tea per capsule, if that's your serving size. Well, how do you measure that? How do you determine that you have 100 milligrams of green tea in your capsule? And there is not a good way to do that. What we can do in the lab is we can measure the amount of polyphenols that is in green tea. We can measure the amount of catechins that is in green tea. We can tell you the amount of caffeine that is in green tea. We can tell you the amount of individual catechins or polyphenols or flavonoids that's in green tea. So for instance, we can tell you how much of epigallocatechin gallate, or EGCG, that's in your capsule per serving. What we won't be able to tell you is that you have 100 milligrams of green tea extract in your capsule. Now, so how do you satisfy the regulation that says that I need to perform the test for label claim? Now, this is where quality by input comes in. And so instead of doing a laboratory test, to do that because you can't, you do quality by input. And so now what you do, you go back to your batch records. And so when you perform formulations in your manufacturing, every manufacturer has to produce a set of documents that shows what was inputted into their formula. All right, and you have to keep records of the weight of each of the ingredients that you put into your formula to get that final product. And so what you can do is take your batch records or your blending records, and you can send them, whether it's email or a package, you can send those to a testing lab like our sister laboratory, Culinary Analyticals, and you can ask for quality by input verification. And all it is that we're going to take your batch records or your blending records, and we're going to verify that at some point in your manufacturing process, you did measure out, because you should have a record of that you measured out whatever quantity of green tea, and you measured out the appropriate quantity of green tea for blending. And we should be able to see from your batch records that you took green tea, the raw material, and trace that up to the capsule formulation, and determine that you do have a record to show that your final product would contain 100 milligrams of green tea in your capsule. So from input of your raw materials and whatever else goes into your formulation, in your batch or blending records, to your capsules, we should be able to find out that yes, you did input green tea in the appropriate amount that would measure out to 100 milligrams of green tea in your final formulated capsule product. And so now we can look at that, determine that you did put that amount, that correct amount in, and we can create a certificate of analysis that says test method, quality by input, your analyte, green tea extract, and we can verify that you did input 100 milligrams per capsule. So now you did not perform a physical laboratory test. What you did perform was a review of the documentation records to verify that the manufacturer did, based on his records, did input sufficient material to claim that that is consistent with what's on the label. And that in essence is your quality by input. It's a verification or review as opposed to an actual laboratory test. And this again is a valid test. It is a recommended test where there is no way you can physically perform a lab test to make that determination. The alternative is that you can physically review the batch records to verify that this is what was done. Again, you can only go by what's in the batch records. Okay, so you're not there to physically see the manufacturing technician mix the ingredients. So you're taking them at their word that they did it because they have a batch manufacturing record that says that they did it. Again, it's the same thing that the FDA or any other regulatory body would do when they audit a manufacturing site. They would actually go in and use those set of records to verify that that company did manufacture that finished formulation in the manner that they said they did. And so as a lab, you're just doing the very same thing and signing off that says we've reviewed the batch records, and we can confirm from the review of the batch record that this manufacturer did add the equivalent of 100 milligrams of said ingredient in their formulation to come up with that particular serving size. So there's a level of trust that's involved, but it's the only alternative that we have, so that we can show what has happened during the manufacturing process. Now, the other time that we can use quality by input is if the product can be tested, but based on whatever reason, maybe the amount tested is below the quantification limit of your analytical test equipment. And again, that would then be appropriate to use quality by input method. But where you can, where there is a laboratory method, where there is a test method that can be used to verify your label claim, then the quality by input method would not be appropriate. So in closing, let me say this, that when you use quality by input as a test method, I'm using it in that regard, you have to have a justification. You have to have a valid justification as to why you're using the quality by input method instead of an instrument or laboratory test method to verify your label claim. And it should be, in those instances, your justification should be that the test method, available test method may not be appropriate to detect the quantity that's in the formulation, or in most cases that I've seen, it's where you have a botanical or herbal product where you can identify the various active ingredients in a herbal product, but you cannot actually determine the quantity of the herbal product used in your formulation. And in those cases, it would be appropriate to use quality by input as verification that a manufacturer did do as they said that they did. And again, and that's done by reviewing the batch records. So those would be the justification, and those would be the reasons and how you would use that method of quality by input. Again, if you're listening to this and you would like more information on anything that has to do with quality control and quality assurance and regulations in the dietary supplements or your cosmetics or your cannabis hemp industries, please feel free to send us an email. It is cthomas@dsnutra.com. Again, that's cthomas@dsnutra.com. If you want some coaching sessions, I'll be more than happy to schedule some coaching sessions with you to go through various aspects of quality and regulations as it concerns with the dietary supplements and hemp industries. I hope you found this information useful, and again, if you did, please feel free. I definitely would like for you to subscribe and be a part of our team as we bring forth more information. All right, have a good day.